Could your pain relief medication be raising your risk of dementia? Well, we're going to look at it. Brand new study from Korea showing that there's an increased risk of dementia of all types with people using Tramadol for greater than 3 months. Hi, if you're new to my channel, my name is Brian and I practiced medicine for 30 years. And one of the things that I did was help people who were dependent on medications. And Tramadol was one of the more difficult ones to get people off of. I took care of a guy that kind of got himself in trouble with Tramadol, and it took a good 4 to 5 months to get him weaned off of his Tramadol because it was giving him so many side effects. Most of the patients that I took care of that were dependent on medications and narcotics needed to be on those medications for chronic pain syndrome. I had a guy that fell off of a building at 10 stories on a construction site and landed on his feet, and it didn't kill him. So he was in chronic pain, and we had to manage him so that he wasn't in agony and had some quality of life. Tramadol is an opioid agonist, so there is the possibility of becoming dependent on it and becoming tolerant on it. And some people take it for prolonged periods of time. In this study, they looked at 1.8 million people over the age of 60, both men and women, and followed them for 14 years and assessed their risk of developing Alzheimer's dementia and all forms of dementia. They found an increased risk of all forms of dementia after only 15 days of use for Tramadol, with a significant rise after 90 days of use. So one of the strengths of this study is the fact that they had so many patients in it, almost 1.9 million, and they followed them for 14 years. But there's some limitations. The big limitation of this study, it was retrospective. So it was a population-based retrospective cohort study. It was a large number, but you cannot prove causation with a retrospective study. Another limitation was confounding factors. They did adjust for sex and age and all that, but they did not adjust for lifestyle factors, severity of pain, diagnostic criteria, which may have influenced the results. However, there was a large number of people over 14 years that were evaluated, and they found a 14% rise in all causes of dementia after just 15 days of use. And after 90 days, that risk rose to 18%. So what can we conclude from a retrospective study? That randomized clinical trials and prospective trials may give you an answer as to whether or not Tramadol really does cause dementia. But it should make clinicians think twice about using Tramadol for prolonged periods of time in patients over the age of 60. Have a great day, and I'll talk to you later. Bye.